The best part of my job is being in surgery. I like to see my patients in the post-transplant period when they come back and they'll tell you how they're doing. Months later, they're in clinic and they recognize me and they scream my name. That's always nice to hear. But the best part, I think, is being in the OR. Yeah. I think I can recall back to my childhood, and I can remember my grandma. She would leave the house in a white dress and white shoes. All I knew then was that she worked at the hospital, and I didn't know what her title was. You know, she will take care of some of the people who lived around the neighborhood. It was a rural area. That was my first exposure to medicine. In medical school, you kind of get exposed to all these specialties, and surgery being one of them. I knew that I couldn't sit around just doing nothing, so I'm a manual kind of person. I like to get up and do things, so I kind of knew then that I wanted to do surgery, so that was my motivation. Transplant, you can do almost everything. You can do vascular, general surgery. In kidney, you can a little bit is part of urology when you have to connect the urine to the bladder. Hepato-Biliary Pancreatic surgery, or HPV, has to deal with diseases of the liver, the biliary system, and then the pancreas. So, for example, if you have a patient who's on dialysis, they have end-stage renal failure. Patients with diabetes type 1, they have pancreas that doesn't work and doesn't produce insulin. If you have a patient with liver failure, the liver doesn't work. And so to be able to make a significant impact, and almost immediately when you do a transplant, you get an immediate outcome, and that's very satisfying. For some of them, this is the first time that they're going through surgery. So you just gotta be honest with them, tell them what the expectations are, what things can happen after transplant, what to expect, what not to expect. They can tell you the next day after surgery that they feel much, much better. I'll tell you an experience that I had recently. I was walking on the hallway about 2 years ago, and I hear this voice, somebody calling my name, Dr. Franco, Dr. Franco. She asked me, do you remember me? And I said, just give me a hint, because I really don't. And she said, well, you transplanted my daughter when she was 6. She started showing me some pictures when she was in high school. And now she showed me a picture when she's graduating from college. And now she's gonna have a family. That's the kind of impact that transplant has on some of those patients. And that's very rewarding, and that's why I do transplant.